Hey folks, it's Dr. Mike again. I'm back for the fifth installment of Medical Exercise Training 101. There it is. You go over to medicalexercisetrainingebook.com and download your copy. I think they're like $14, $15. And this is the fifth installment, and this is probably one of the most common questions that I get from the medical community in significant numbers, and one I get a lot from medical exercise specialists that are going into PT clinics and trying to pitch and get referrals. So this is one that you really want to listen to closely. So item number 5, this is on page 11 in the Medical Exercise Training 101 manual. How are MET services different than physical therapy? Now folks, this is a question, like I said, that a lot of people ask. For a number of years, I worked with a gentleman by the name of Nitin Chota in conjunction with another physical therapist by the name of Jamie Shire. Nitin, as many of you may know, had a program to help physical therapists with their marketing and practice development. Well, I was one of Nitin's consultants for a couple of years, and I would present a segment to the physical therapists on developing medical exercise training services, and the physical therapists always had a problem with understanding how medical exercise training fit in. They thought it was stealing their patients. They thought it was a low-level attempt to do physical therapy without having the proper licensure. So it was one that we really had to make sure that we were clear on and were able to differentiate. So if you don't mind, let me read this for you. Medical exercise training does not provide any aspect of medical treatment, including heat, ice, electric stimulation, joint mobilization, etc. Those services are provided by a licensed physical therapist or chiropractor or occupational therapist. Physical therapy is used in the acute and subacute phases or stages to reduce inflammation and restore function. With the changes associated with insurance reimbursement, physical therapy is now primarily focused on the acute and subacute injury management. Medical exercise training begins where physical therapy leaves off. So once the client has been discharged from physical therapy services, whether it's because the insurance carrier said we're not paying anymore, the client reached their plateau, whatever the case is, MET comes after that. It is not designed to be used in lieu of physical therapy services. As a medical exercise professional, you are not equipped to manage a client in the acute or subacute stages. The niche for MET is focused on the client beyond the subacute stage, primarily that chronic client. Physical therapists are specifically trained to provide rehabilitation services using assessment and treatment techniques. They work with a wide range of patients. There is a significant overlap between MET and physical therapy when the patient enters the chronic stage of the condition. And now remember, we talked about the nomenclature. When that individual is receiving medical care, they're a patient. When they're working in exercise services or fitness services, they're a client. As a medical exercise professional, it's important you understand your scope of practice and role. Physical therapists can be a large and significant referral source for your practice. When you approach a physical therapist, make sure you clearly articulate your scope as a medical exercise professional and how you will assist the client to improve their level of function after discharge from physical therapy. Establishing and maintaining good rapport with physical therapists in your community is essential in building a strong and profitable practice. Now, folks, as I mentioned in one of our early videos, in the early years, when we started this concept of the medical exercise specialist trainings and certification workshop, we had some physical therapists that were, vehemently opposed to the idea. They thought we were selling out. They thought we were allowing lesser trained individuals to provide therapy services. But what we were looking at was just the beginning of the wave of change that was coming from insurance carriers. We had to move our patients out of the clinic faster, and we didn't want to turn them over to the muscleheads in the gym. We needed someone there that had some level of understanding as to how to manage these clients. And our medical exercise specialist training series is extremely comprehensive in that it goes over what we consider the 5 medical exercise sciences: clinical anatomy, clinical pathology, exercise physiology, kinesiology, and some aspects of biomechanics. Along with that, we give you additional training in the assessment process, in the screening process. We give you protocols so you understand how to manage these different medical conditions. And I think one of the most important things is we talk to you in depth about how to communicate with the medical community. So we look at the idea of the differences between PT and MET. PT is a professional provided service. that individual sustains an injury, they have surgery, they have a condition at the outset, that person needs physical therapy services to get them medically stable, to get them functional to the point that they can now do basic activities of daily living. Then, as they progress through physical therapy and they reach either a plateau or they reach a point where the insurance carrier or the medical professional feels that they're independently functional, so they can function independently, then they're discharged, and now they can come to you for those residual functional deficits as far as managing those that we talked about, I believe, in installment 3 or 4. Your job is all about the residual functional deficits. You're going to clean up everything that's left over after physical therapy. And folks, to some degree, you may say, well, the physical therapist should have done this. No, they shouldn't. The insurance carrier is putting clamps on them, and the physical therapist has a waiting list a mile long. Okay, so when these individuals are done, they move them out of the clinic and they send this individual over to you, this client, and you get started with exercise, strength training, cardiovascular training, flexibility training, endurance, balance, aquatic training to help manage those functional deficits. Okay, so this becomes a collaborative effort. So this item, Medical Exercise Training 101, topic number 5 or question number 5, this one is one that as a medical exercise specialist, you've got to be very clear on. You've got to make sure you're able to define your role and your scope and tell that to the physical therapist. For the physical therapists and chiropractors and medical professionals out there, the medical exercise specialist is not trying to take anything away from you. They're really there to catch that patient that you're discharging. It becomes their client and they can manage the client, but they're communicating with you. They literally are your eyes or ears out there in the community after you've discharged this individual. And they can, with the training we've provided, identify red flags that indicate the client needs to come back to you, but also they can manage this client to fruition where they reach that level of function that they can go back to work, go back to their home lifestyle, go back to their sporting level or level of sports, and they aren't continually coming back to you with the same old problems. So again, thank you for joining us. Wish you all the best, and we'll see you in installment number 6. Thanks again. And go over to medicalexercisetraining ebook.com and get your copy. All the best, folks. Have a great weekend. Bye-bye.